Welcome to StantonMD. I'm your host, board-certified emergency physician, Dr. Ryan Stanton. In this episode, we are talking about emergency medicine and what we are doing to ensure we are ready for any emergency that presents at our doors. I recently spent 5 days at the American College of Emergency Physicians Conference in Las Vegas, Nevada, with over 8,000 other doctors meeting and talking about emergencies from around the country and around the world, seeing what is being done to advance care and be there in the time of need. We will feature a few of the physicians there and the tools that we found. We will start with Dr. Sudev Mindarata, who will talk about the benefits of the conference and a unique space designed to familiarize emergency physicians with the most cutting-edge technologies available. Also, after that, we will talk with Dr. Henry Curtis, who's an emergency physician but also has an interest in film and production. He uses those skills to bring innovative experiences to the attendees that immerse them in rare yet high-risk disasters that may impact the city. Finally, we talk with Dr. Jay Kaplan, immediate past president of ACEP, who talks about emergency medicine, the benefits, challenges, and future. First, Dr. Sudev Mindarata joins me in the Innovate ED to talk about cutting-edge medicine and the future of emergency medicine. Dr. Sudev Mindarata is the residency director and an emergency physician in Chattanooga, Tennessee. He is instrumental in arranging the educational opportunities at the American College of Emergency Physicians annual conference.
ACEP16 is the pinnacle conference for emergency physicians in the United States. It allows us to come together to exchange ideas and information, network, and learn about all the newest research and how it impacts our patient care. We also get together and are able to understand each other's practice patterns, learn from each other, network, and also create an opportunity for change at the national level with our advocacy efforts.
One of the elements that has played a major role in the past few years has been the Innovate ED, a space in the exhibition hall that features new tools and technology that will make up the future of emergency medicine.
Innovate ED is the showcase for new technology. It's like a crystal ball into the future, but the future is now. These are products that are cutting edge, that are unique, and are making changes in patient care. From ideas to share information better within the emergency department to new technologies that allow us to care for sicker patients in a more efficient fashion. We're bringing battlefield technology to the ED, information technology to the ED, and also cutting-edge thinkers in Incubate ED, allowing them to emerge, share their ideas, and get some traction with even some venture capitalists. Emergency medicine on the front lines is an ever-changing field. Most of the products in Innovate ED have been released within the past 12 months. Some of the products were actually not even on the market yet. So the changes that occur with our emergency physicians and the technology, it occurs at a daily basis. It's important for people to come out and to come to a meeting like ACEP16 so we can learn about these new technologies and also apply them to our patients.
In Innovate ED, you see emergency and trauma bays with simulators, actors, and dummies designed to immerse the participants in the new technology and see what it looks like in their environment.
And we're taking ultra high fidelity simulators and using them in an integrative fashion so a physician can see how new products, new ideas, and new technologies can impact patient care in their usual daily workflow. We take pre-hospital patients all the way to the operating room. Using these simulators, a physician can understand how the technology translates into their daily practice. It's important to be prepared and to train and to understand that we can see as emergency physicians anything at any time. This allows us the opportunity to practice medicine and rehearse in a safe environment that's controlled for situations that we don't see on a day-to-day basis. Mass casualty incidents, critically ill pediatric patients, bomb explosions, earthquakes, mass casualty shootings. These are types of things that we can rehearse here in the trauma bay at Innovate ED. We can use these simulators to practice on high fidelity models. We can use these simulators to prepare for critically ill patients in the emergency department, so we're all on the same team. We can also use these simulators in a multidisciplinary format where we engage our nursing staff, respiratory therapists, and even hospital administrators to help improve the delivery of patient care. The realism of a high-fidelity simulator allows us as physicians to get as many senses involved with the simulation. We're able to have the same fear, anxiety, and procedural skills that we do in a real patient with a simulated patient. This allows us to replicate as best we can the real patient scenario, allowing us to train in a fashion that we're going to practice.
One area that will play a key role in future access, especially to rural populations, is telemedicine. Dr. Mendarata sees this as the future of access to the highest quality care possible.
Telemedicine allows for instantaneous information exchange and consultation among providers with a minimal investment. Telemedicine allows a patient from a rural area to talk with a subspecialist in a very large tertiary medical center. Telemedicine connects providers together and improves patient care through technology. Using integrative products, we're able to implement telemedicine in a variety of applications. Here you can see that telemedicine is linked to emergency department flow, patient throughput, and increases quality of care at a reduced cost. Telemedicine currently is not implemented throughout the country. Telemedicine is important for rare conditions or for specialty evaluations currently, but it's evolving. Patients are carrying smartphone applications. They're allowing their connect to a healthcare provider just over the phone. Telemedicine will continue to grow as patients demand instant interaction with a healthcare provider. Now, we do lose a little bit of the physical touch with telemedicine, but we're able to deliver high quality care instantaneously. All patients can benefit from telemedicine, from the baby boomers all the way down to the millennials. What we're seeing though is an explosion of utilization of healthcare online resources by millennials, both healthcare and education of healthcare professionals, but also millennials accessing healthcare from their smartphone or from their computer, providing patients with high quality medical consultations and peace of mind without having to leave their community.
In the end, the meeting and Innovate ED are about better care, bringing the most advanced technologies, techniques, education, and tools to emergency patients.
Some of the patient changes that you may see are improved patient tracking systems. That allows patients to be seen quicker, to reduce errors in the emergency department, and also improve emergency department flow. A patient might also benefit from some of the new technologies, point-of-care ultrasound, ultra-rapid CT scanning, and pre-hospital technologies for hemorrhage control and safer, more comfortable transport.
Innovate ED will continue to grow in its role at the ACEP annual meeting. As the conference grows, more and more emergency physicians from around the country will be bringing more advanced care to their patients and communities. More StantonMD coming up. Stay with us.
Don't let cancer keep you from enjoying the little moments in life. Court Physical Therapy knows those moments are important, and cancer doesn't have to slow you down. Studies show that people who routinely exercised had a 40 to 50% less fatigue rate and significantly decreased their risk of reoccurrence. Court empowers you to take an active role in your recovery and get back to enjoying life. Whether you like summer cookouts, Little League baseball games, or a trip to the lake, Court will design a plan to ease tightness, aches, and pains and increase strength and flexibility. Court is there for you every step of the way. For more information, visit KORT.com. Court Physical Therapy.
Pain management medicine features cutting-edge technology to evaluate, diagnose, and treat pain. They address the source of pain and its contributing layers through a comprehensive approach with evaluation, fitness, and targeted procedures. Treating the source, they bridge the gap between functionality and pain. Doctors at Pain Management Medicine are subspecialty trained anesthesiologists well-versed in the latest technologies and techniques for addressing chronic, neuropathic, or cancer-related pain. For more information, visit painmm.com. Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@StantonMD.com. That's info@StantonMD.com. Now, back to the show. As a board-certified emergency physician, Dr. Stanton is a proud member of the American College of Emergency Physicians, also known as ACEP. ACEP provides physician and evidence-based patient resources at its consumer website, emergencycare4u.org. That site has stories, fact sheets, and advice on a wide range of emergency topics. From visiting the ER to mom tips, you can find them on emergencycare4u.org. Now, back to the show.
Welcome back. We've talked about Innovate ED with Dr. Mendarata, and now we will see one of the other features that brings the action of mass casualty situations to the doctors and participants at the conference. Dr. Henry Curtis is an emergency physician at Stanford University in California. He's the director of 2 programs at ACEP16 that not only bring rare mass casualty situations to life in the Innovate ED, but also make the participants part of the action.
Okay, so I'm an emergency physician at Stanford University. I've been there for about 3 years right now. I was brought in as a simulation content expert, and I've now also moved into medical humanities and am pursuing a Master's of Fine Art in Directing at the Academy of Art. So I'm kind of able to combine my simulation skills from my fellowship along with my film skills from my MFA together with my emergency medicine critical care skills and put together education. Large projects we have at ACEP are Code Black and MCI Immersive Response. They're very different, but both trying to achieve similar educational objectives to promote disaster readiness for ACEP attendees.
The first program is known as Code Black, named for the movie that has since been turned into a television show that dives into the world of emergency medicine. In Las Vegas, Code Black takes the doctors into the scenario of a large earthquake in the area.
So for ACEP Code Black, we're offering an immersive experience to the ACEP attendees. We're creating an environment that has multiple elements, including live performance, video, and the use of innovative products to respond to a mass casualty incident after a large-scale earthquake. We have filmed multiple scenes of disaster from Disaster City and also from the Las Vegas Speedway, and we've spliced them together, and we want an experience where people are seeing action in front of them, and at the same time they're also able to observe media that relates to that action in front of them, that live action in front of them, and also to experience a breaking of the fourth wall, if you will. We have the stretchers coming through the audience. We've placed one of our actors with an injury deep within the audience. We have a triage physician who goes through the audience and who triages people and actually puts RFID trackers on them, which are later shown on the screen so they can be tracked within the Innovate ED space. So we're trying to create an immersive experience for the attendees without actually having them manage the incident, such as they would in MCI Immersive Response.
The other program deals with a scenario that has been in the headlines in recent years, a mass casualty situation involving a shooting.
We've selected 3 ACEP attendees per day, and those 3 ACEP attendees are getting a chance to manage a simulated mass casualty incident after an active shooter incident. And so they're basically in Trauma 3 in the Innovate ED space. There are multiple victims that come in. There are also innate stressors that come in as well. Things like administrators that aren't working on their team, VIPs who demand special treatment, people who are family members searching for loved ones who aren't there. There are multiple stressors that we've brought in to this, and just we've given them a chance to manage those stressors along with high patient volume and high patient acuity. We added the pilot of immersive response, and this was at the request of Dr. Jim Augustine. He basically identified a large need for more education for active shooter incidents. And we wanted to have an engaging scenario where ACEP attendees could actually participate and learn from that participation and the debriefing afterwards, and to improve their disaster readiness for active shooter incidents.
These may seem like unusual circumstances and scenarios, but the physicians that experience them here can take home what they learn in the event of a mass casualty situation in their community.
I believe this is vital education for ACEP membership. We're giving them ideas that they can take home with them about how would you technically respond to a mass casualty incident, what are the logistics behind that response, what innovative technology can you adapt to help improve your response. We want to get people thinking about all these things, and then to go home and work on their plans, work with other experts in the field, and improve their disaster readiness so that when a disaster comes to their home, they're ready.
Next year, there'll be new scenarios and experiences for those at the conference in Washington, D.C. In the end, we hope nothing like this happens in our communities, but we want to be ready and prepared if it does. More StantonMD coming up. Stay with us.
Don't let cancer keep you from enjoying the little moments in life. Court Physical Therapy knows those moments are important, and cancer doesn't have to slow you down. Studies show that people who routinely exercise had a 40 to 50% less fatigue rate and significantly decreased their risk of reoccurrence. Court empowers you to take an active role in your recovery and get back to enjoying life. Whether you like summer cookouts, Little League baseball games, or a trip to the lake, Court will design a plan to ease tightness, aches, and pains and increase strength and flexibility. Court is there for you every step of the way. For more information, visit KORT.com. Court Physical Therapy.
Pain management medicine features cutting-edge technology to evaluate, diagnose, and treat pain. They address the source of pain and its contributing layers through a comprehensive approach with evaluation, fitness, and targeted procedures. Treating the source, they bridge the gap between functionality and pain. Doctors at Pain Management Medicine are subspecialty trained anesthesiologists well-versed in the latest technologies and techniques for addressing chronic, neuropathic, or cancer-related pain. For more information, visit painmm.com. Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@stantonmd.com. That's info@stantonmd.com. Now, back to the show.
Welcome back. Emergency medicine is a relatively new specialty spanning less than 50 years. During that time, it has gone from a literal room to evaluate doctors' patients to a specialty that sees over 140 million patients annually and is playing an ever-growing role in the healthcare system. I had a chance to talk with the immediate past president of the American College of Emergency Physicians. Dr. Jay Kaplan talks about the importance of the ACEP meeting and the evolution of emergency medicine as a specialty.
The ACEP conference is important because it brings together more than 7,000 providers of emergency medical care who then have the opportunity to learn best practices, to learn the latest and the greatest in terms of giving superb service and quality outcomes to our patients, and who have the opportunity to network and learn from each other. When I first started practicing emergency medicine in the late 1970s, there were no emergency medicine specialists. So if a person went to an emergency department, they might see a doctor who was a ENT, ear, nose, and throat specialist, who was waiting for his practice to build up. Now, when members of our community come to an emergency department, they can have the confidence that they are being seen by a physician who has been specially trained in emergency medicine. They can expect high quality, compassionate care. The emergency department was the window to the community. Then we became the door to the hospital, and we now know that in most cases, over 60% of patients admitted to the hospital come through the emergency department. At the same time, we know the importance of primary care. And so we are now seeing ourselves in the emergency department not just as the door to the hospital, but as the porch of the medical neighborhood. We are part of the acute care continuum, from the doctor's office to the emergency department, and then back to the clinic or back to the doctor's office. And so how we transition the information and the care that we've given to patients to the next provider is crucially important.
It's not all positive. With growth and an evolving system, there is stress on the emergency medicine system and the people that provide the care.
Department, because our hospitals do not have the capacity to rapidly and efficiently take in patients who we as emergency physicians feel need admission into the hospital.
As more pressure is placed on emergency services and the system in general, more people are turning to the emergency department for their care. The benefit is that the emergency department allows complex workups for acute conditions to be completed in a compressed time frame that cannot be achieved in most other settings.
Patients benefit from coming to an efficient emergency department because we can get done in 3 to 5 hours what it would take their primary care doctors or other specialists could be a week to 2 weeks to get done. When people come in with a complaint, we have the availability of all specialties. We have the availability of all imaging and diagnostic laboratory testing at our fingertips. And so we can apply that to the problem the patient brings to us, and in most circumstances get them an answer within a period of several hours. Sometimes the answer is, we don't quite know what you have, but we know it's nothing life-threatening or serious, so you can relax about it, and in time the diagnosis will become more apparent.
This growth and expansion of emergency medicine has strained the hospitals, departments, and physicians. Recent surveys have demonstrated that nearly 2/3 of emergency physicians have some level of burnout, and over half qualify as having PTSD. That is why ACEP and Dr. Kaplan are making a huge push for physician health and wellness.
It's important to focus on the wellness as well as the care of our patients for several reasons. One is there is pretty good evidence now that physicians who are burned out do not deliver the same level of quality and caring that we'd like to give to all of our patients. And so I like to think about it that unhappy doctors and nurses don't make for happy patients. And so we have to simultaneously focus on creating a great place for patients to come for care at the same time that we focus on creating a great place for doctors and nurses to practice medicine.
He summarizes this with a motto that he uses with his wife and now applies to emergency medicine.
So the line that my wife and I agreed on was, I'll take care of me for you if you'll take care of you for me. Physicians are not terribly good at recognizing burnout in themselves. And if we begin to connect the dots and we begin to see that if we take care of ourselves, then the personal side of our lives go much better. And then the care that we give to our patients in our work environment goes much better. So wellness and developing resilience in ourselves as emergency physicians is crucially important, not only to us and to our families, it's also crucially important to our patients.
The future of medicine isn't into limiting access to the emergency department. Rather, it is to support the role of emergency medicine as the hub of healthcare. allowing us to efficiently evaluate and stabilize patients, then disposition them to the care they will need moving forward. It's time now for 5 tips to healthier living. Since we've been talking about emergency medicine, this would be a great time to give you some tips to a successful trip to the emergency department. Of course, we hope it's not necessary, but just in case. First, make sure you establish and regularly see a primary care physician. The best medicine is prevention. A PCP can help screen for disease, diagnose common conditions, and help manage and stabilize chronic illnesses. Prevention and maintenance can avoid the ED altogether in most cases. Next, compile critical data. Even though we live in a time of electronic medical records and technology, getting to that data and ensuring it's accurate can be very challenging, especially if someone is critically ill. I recommend having a folder that is handy which has pages outlining your medical problems or diagnoses, allergies, medications with dosages, and pharmacy, as well as any advance directives or next of kin information. This can be invaluable information when you present to the emergency department, and honestly, it can save your life. Third, be patient. U.S. emergency rooms are seeing over 140 million people every year. This has resulted in longer wait times across the country. EDs will see patients in the order of need and acuity, not necessarily on the time of arrival or wait. I assure you that the staff is working as efficiently as possible and don't want to have to see anyone waiting for extended amounts of time. Just remember, we don't control how many people seek our care, and we never know when there will be a rush of critical patients. Next, seek that proper level of care. This can help avoid some of those wait times if you have a minor condition. Urgent treatment and walk-in clinics are nice for minor illnesses that can't wait until regular business hours with your PCP. I advise my patients that if you know the problem and the solution, it's probably okay for urgent treatment or waiting to see your doctor if it's stable and not in need of emergent attention. I also advise my patients that if the issue involves the head, chest, or abdomen, it's probably best to go ahead and go to the emergency department where we have the tools to help diagnose complex problems. I regularly see folks that go to a walk-in clinic first and are referred to the emergency department for further evaluation and management. Finally, if you have a true emergency, call 911. I often see patients with heart attack or stroke drive themselves to the emergency department. This puts you and others on the roadway at risk. If it's an emergency, 911, so they can start care earlier and safely transport you to the emergency department. That's all the time we have for this episode of StantonMD. If you missed an episode or want to watch a segment again, you can head to our website at StantonMD.com. I also invite you to join our community by liking the StantonMD Facebook page and following me on Twitter at EverydayMed. We welcome your comments and suggestions. Email us. The address is info@StantonMD.com. Until next time, I'm Dr. Ryan Stanton, and this has been StantonMD.